So kidney disease is very common, and all of us, because we have kidneys, are very predisposed to getting kidney disease, especially as you grow older, but also as you grow older, as you pick up diseases. The commonest diseases that lead to kidney disease is high blood pressure and diabetes, but also others can come along. So the disease itself can cause kidney failure, but also the treatment of the disease can lead to kidney failure. So this is, for example, in the case of HIV, the disease itself, but also the drugs that treat the HIV can lead to kidney failure. Many patients with kidney failure, unfortunately, present very late with advanced disease. And this is because we call kidney failure the silent killer. So it does not give you any symptoms. Most of the time, by the time you have a symptom, it means you have advanced disease. So the advanced disease symptoms that people usually will get will be things like body swelling, feeling tired all the time, itching, your body's itching a lot. So sometimes patients will come and they just have a headache, and you happen to check and you find that their blood pressure is very high, and then you find out that this is because they have kidney failure. We've talked about some of the causes of kidney failure. So we talked about the diseases that you get, that you pick up as you grow older, but also some of the habits that you have. So for example, drinking water. Most people don't like to drink water, myself inclusive, but water really helps the kidney, because the kidney works with water. The job of the kidney is to remove the toxins in the body, and it does this by producing urine. So if you have water, it has something to work with, because it puts the toxins in the water, and then when you pass urine, the toxins get out. So if you drink water, you really help your kidneys significantly. The other thing which is really helpful is to be careful about the drugs that you buy. So one of the most common drugs that lead to kidney failure is over-the-counter painkillers. So the whole group we call NSAIDs, so that's things like diclofenac, aceclofenac, brufen. All of those are a combination of drugs that usually result in kidney failure, especially if you take them when you are severely dehydrated. So you can take it, but make sure that you're well hydrated when you're going to take it. Other things that can cause kidney failure, of course, is when you have high blood pressure which is not well controlled. So that means that if you do have high blood pressure or diabetes, make sure that you're having regular checkups and make sure that it is being monitored and it is well controlled. I always tell my diabetes patients that you cannot treat diabetes unless you're able to monitor the diabetes, because the treatment for it is not a fixed dose. Different people will have different doses, so you can only know what is the right dose for you if you're able to monitor. So if you can't monitor it, it will not be well controlled, and if it is not well controlled, it means that you will end up having kidney failure. So one of, like we say, the habits are drink plenty of water. If you have any illness, make sure that you check it regularly. Avoid over-the-counter medicines, and then have your annual checkups. Once you get to age 40 and above, it's downhill. You begin to get unwell, your body begins to break down. So anybody who's over 40, make sure that you have your annual checkups. And your annual checkups mean that you have your heart checked, but because we're talking about kidneys, also have your kidneys checked. So that's usually a urine test and a blood test. The other test that we usually do to check for kidney function is an ultrasound scan, but if you do it once, then that usually should be enough. If you grow old, especially for men, and you get a big prostate, that can cause obstruction. So in that case, you need to repeat your ultrasound scans regularly to make sure that there is no obstruction, which will lead to your kidneys not working properly. The diagnosis of kidney failure depends on the tests that I've mentioned above, so urinalysis, blood test, ultrasound scan. Once you've been diagnosed with kidney failure, your doctor will stage you. So he will say that you're either stage 1, stage 2, stage 3, stage 4, or stage 5. Stage 5 is the last stage of kidney failure, and when you reach that last stage of kidney failure, usually it means that you're going to need some form of support to the body. So that form of support to the body comes in 3 ways. The first is you can have a discussion with your doctor and agree that you're only going to do medicine therapy. The problem with medicine therapy is that it is short. It means that your life is not prolonged. So it keeps you comfortable but does not prolong your life. So the forms for treating kidney failure are mainly 3. The first is what we call conservative kidney management. And in this conservative kidney management, it's basically to treat symptoms, make sure that you're comfortable. It does not prolong life. It aims to improve quality of life, but not to give you quantity of life. So you would have a discussion with your doctor and you would tell them this is a choice that you choose based on your circumstances in life. The second option would be to do hemodialysis. Hemodialysis is a therapy where the patient is connected to a machine and the machine does the work of the kidney for you in support of your kidneys, which are not working very well. So what the machine does is exactly what the kidneys would have done. So it gets rid of all the toxins in the body. It cleans up the body to make sure that you're back to good functioning. Dialysis, we usually will do it 3 times a week, every week. And that usually is because normally your kidneys are working 24 hours a day, 7 days a week. So the 3 times is a substitute for the 24/7 that your kidneys is doing. And it's a fair substitute, and that's why you need to maintain the 3 times a week rather than shortening it to once or 2 times a week. And then the third alternative is kidney transplant. Kidney transplant is when a loved one donates a kidney to you, and the kidney which is donated to you then does the work of the kidney for you because your kidneys are not working. Now, when we do transplant, usually we leave you with your original kidneys. Those ones remain in the body, and we give you an extra one to do the work for you. But because it's not yours and it's foreign to you, it usually means that you have to take medicine to help your body to not recognize this new kidney. If your body recognizes the new kidney, it will reject it. Like we said, you need water to help the kidneys, keep the kidneys working. Water comes from the environment. So if you have water in the environment and you're able to take it, it means it helps your kidneys. But also if you live in a very hot environment where there is no water, it's very sunny, you're going to sweat a lot, and therefore you need to be very intentional in taking in extra water to be able to supplement what you're losing. So the kidneys and the environment are interlinked, and this is why we're trying to make sure that we combine both kidney health and environmental health to prolong the survival of you and me.